G'day and welcome to Nurse on the Go videos. Today I just want to go through how to do a simple dressing. Sometimes you'll get a person home and they've got a little bit of a wound that just needs to be cleaned up, nothing too drastic. So I thought I'd just run through some of the key principles and how to actually do it. So we always want to do what we call a non-touch technique. So whatever's on the dressing tray, we don't want to transfer it from the wound back to the dressing tray. So it's one-step movement. So you pick up your cotton wool or your gauze from your dressing, clean the wound and put it straight in the bin. So you don't want to take it back, alright? So we just want to keep it nice and quick and simple. So first we need a sterile dressing pack and we need some salty water, some normal saline that's sterile as well. So we'll open out our dressing pack first. So we grab each corners, there'll be two little flappy corners, pull them out and then gently grabbing the underside without touching the inside, grab the underside and tip out the tray's contents. So the gauze, the little dressing shroud and a couple of forceps. So tip them out and then put your saline in on the gauze. Give it a good squirt, and then this is how I like to do my little gauze squares. I like to wrap them in each corner, wrap them up tight, and then squeeze them out, wring them out a bit and put them on the side. Then we're ready to do our dressing. So we only use one forcep to grab the gauze. You start with little circles in the middle of the wound, work your way out slowly, and discard it, and do that until the wound's clean. If you need to get more gauze squares, that'll be for a more complex dressing or bigger dressing, but you can do that. Just get some more gauze and more salty water and put on the dressing. Just make sure that the dressing, to keep it what we call clean and sterile, is that you don't touch it with your fingers or put any dirty stuff back into it. So after you've done your swabs and you've done your circle swabs and you've cleaned up the wound, you can dry it off with a bit of gauze if you need to. Discard that, then put on your dressing. So I'm just using a bit of gauze here and then wrap it with a bandage. I'm just wrapping a bandage, but if you've got a band-aid, if it's a little wound, you can do that too. I'm just showing you how to do it with a bandage. And just wrap the bandage firmly but not too tightly, because you want to make sure you're not cutting off the blood supply to the lower part of the limb. Keep the blood flowing nice and evenly, and just check the fingers that they're nice and pink. If they start going blue or the person says it's feeling tingly, the dressing is too tight, you need to take it down and re-bandage it. After you've finished your dressing, discard all the waste in the normal waste bin, unless it's heavily blood soaked. That's when it needs to be disposed of differently, but usually you can go in the general waste, and then your dressing should be nice and ready to go. So I hope you like those little tips there. My name's Phil, I'm here to help you care, and thanks for watching Nurse on the Go videos. Take care for now, bye bye.